Welcome back, Fertility Tip Tuesday. I am here with my good friend, Dr. Raquel, and she and I are both coming to you from Los Angeles, California. Reminder, I'm Alice Crisci, co-founder and CEO of MedAnswers, creator of the Fertility Answers app. Dr. Raquel is a naturopath fertility specialist, the first in the world to be fully integrated in IVF practice. We're so excited to have her here, and we have an important conversation today, don't we?
It's all the jazz.
It is. And it's the only thing in my newsfeed. It's the only thing people are talking about. There is like nothing else going on than coronavirus right now.
I'm so over it.
I know. It's everywhere. And the panic just keeps rising. It just does. So what I want to start with before we dive into, to kind of your advice and your tips and so forth is I want to address first the American Society for Reproductive Medicine came out with a joint statement last week with START, the CDC part of reproductive medicine and the data tracker for our field. And they brought up, I think, a really important point about this. If there's a travel ban and you are an attending parent who's using a gestational carrier in another country, you potentially need to troubleshoot who's going to watch your newborn if you can't get to your baby.
Wow.
I had not even considered that. And that just made my heart explode in a million pieces. I thought, I cannot fathom being separated from my 6-year-old, let alone not being able to get to my newborn.
And it's true. It's true. And something that I want to just make sure that we start this whole thing off with is to take a deep breath. Okay. And wash your hands. Just wash your hands.
That's right. Wash them. I should have had hand sanitizer on the show today. We should have just had hand sanitizer.
And that's something.
Wash your hands. Right.
It's the number one preventer of this virus. And so I love that you brought it up about the intended parents, because the biggest thing for, let's just say, like you said, you are a surrogate and you are in control of your body and you're getting ready to have this baby for this family. It's important for you to also understand what you should be doing to prevent the transmission. And the number one way to prevent it is to wash your hands. And I know you tell your son all the time to wash his hands, but adults do not wash their hands.
Well, I feel like with this virus, it's given me a good educational opportunity to encourage him to wash his hands more. We don't overly wash our hands from playing in the dirt and from doing all the important things to get good immunity. So I've been talking a lot about the washing hands in service of our community. That we have germs that our neighbor might not have, and we don't want to transmit our germs that might not be making us sick, but they could make our neighbor sick.
Exactly.
And so it's been a really good educational opportunity from that perspective.
Yeah. And for some reason, I understand it's something new. People are dying from it. There are fatalities, but it's very important to point out that of the 86,000 cases currently worldwide, 46,000 of them have been treated and have recovered. The fatality rate is only about 2%. But as we know, the media tends to exacerbate things and freak us out. So now we're scared to go outside and play with our child. We're scared to go to the doctor's office. We're scared to do anything because they're focusing all the attention around this fear around this many people died. But 46,000 people recovered,
have recovered.
So I think it's important to say, this is very real and we should take precautions, but there are measures that are being taken to protect us as well.
Now, compare that for us to the flu. What's the death rate of the flu? Every single year, what's the death rate of the flu?
So I was looking at this today, and the thing about the coronavirus that's very similar to the flu is that they are both very resistant to medication. So the death rate for the flu, the last I checked earlier today, I think it was about maybe 3.8%. And that's every single year. Whereas this virus kind of hit us all at once. And so we're able to see all these fatalities all of a sudden. And so that's what's happening, is that unfortunately there is no vaccine and there is no treatment. So if you get it, you just have to hope that your immune system will kick into play.
Well, you're the best person to talk to about gut health and the impact of gut health on immunity And that's, I think, where we need to focus our tips today is talk to us about how important gut health is in overall immunity, first of all, because we're exposed to viruses all the time.
All the time.
I mean, there's no shortage and there will never will be a shortage. They'll knock this down just like they did with SARS. Zika's still around. We're managing with that. We manage with the cold, with flus, with viral, all kinds of viral things, viral sinus infections versus bacterial, viral respiratory infections. So talk to us about how important gut health it really is to our overall immunity.
And I think this is something that is undervalued because 80% of our immune cells are in our gut.
80%
of our immune cells are in our gut. So many people don't know that. So many people underestimate that. And we tend to wonder why people that have autoimmune conditions feel better when they clean up their diet. It's because,
oh my gosh.
I know your gut and your immune system have a synergistic relationship. So they work with each other and it's mutual benefit. So what happens is, let's just say you ingest something and it's something foreign and your body doesn't like it, like a virus or bacteria. What happens is your gut has these immune cells known as Peyer's patches, and these Peyer's patches release white blood cells, which tell your immune system, let's kick into play. So think about if your gut is not functioning optimally and you have leaky gut. So now when you interact with this foreign substance, your body has no way to tell your immune system, let's kick in. So you get exposed to these foreign antigens or these foreign antibodies. You're more susceptible to get sick. Yeah.
Okay. Now we have heard that. Okay. It makes me want to just reach in there and kind of give some love and nourishment to my gut right now, Raquel. I just want to give you a hug, bring in goodness. Let's start there. What are some of the nourishing things you can do for gut health? Because, some people are not in a position necessarily where they're just going to do a complete overhaul to their gut health right this very moment. But what are some of the nourishing things they could do right away that could be helpful to boost that immunity?
Yeah, because it's definitely a mutualistic relationship. Like just as much as the immune system needs the gut needs the immune system as well. So you want to make sure you're consuming foods like probiotics, number one, because we have trillions, not millions, billions. We have trillions of bacteria in our gut, right? Literally 150 times more cells than our genome exist in our gut.
Wow.
So we want to make sure
times more than the genome. Holy cow.
Yes.
Okay.
Yes. And so we want to make sure that we're consuming foods that are helping us to balance this good bacteria and this bad bacteria, because we need both of them. So some of the major ways are probiotics, because they help us balance this bacteria. Also omega-3s, a really easy way to get these if you don't consume fish or you don't eat a lot of nuts and seeds is you can take a really good fish oil. A really good omega-3, making sure you're having about 1 gram a day is a really good place to start. And you want to make sure you're increasing your omega-3s, but limiting your exposure to omega-6 fatty acids, which is going to be more dairy, red meats, things like that.
Got it.
So those are really good places to start, is having a probiotic, having omega-3s, and then having an adequate amount of fiber. So that could be from green leafy vegetables, adding chia seeds to your smoothie, adding all kinds of
great idea.
All different things like that.
When it comes to probiotics, what is more important, or how do you balance the number of billions of strains they advertise versus the number of, billions of probiotics versus the number of strains themselves?
Yes. So that's super important, because what you'll see oftentimes is that the store may have probiotics on sale for $5. Okay. You probably don't want those. So leave those.
Yeah, they are kind of pricey. The good ones are pricey. I mean, I ordered one. It's a powder version for my son and I, and we have it in a water, and it's not cheap.
It's not, and it's because of the billions of bacteria that's included in it. So whenever I run a profile, I'm able to see how much bacteria you need for your gut, or how much of a probiotic you need for yours. So it normally comes in 10 billion.
Okay.
Yeah, it comes in 10 billion, 25 billion, and then 50 billion CFUs. And so you want to make sure that you're having the right probiotics for your gut. So some of us, let's just say, we just need a little help. We just need a little help kind of kicking our gut into play. maybe you can trim more towards the 10 to 25 billion. Those might run you like $30.
Okay.
But if you're always bloated, always gassy, you have a hard time digesting food, things like that, that's when you want to go more towards the 50 billion CFUs. First, of course, identifying what is causing you to be bloated and gassy. But once you get rid of that bacteria, you want to repopulate your gut with at least 50 billion CFUs to start balancing the bacteria in your gut.
So we have one that's 11 different strains. And I know, if you eat yogurt, you've got the acidophilus, but you don't have any other strains. I ferment my own vegetables sometimes. I try to get all crunchy with that. I might drink the kombucha. So, I do enjoy it. I do enjoy doing that. But my question is there's so many different strains. How do you know which one you need? And is that volume of strains? If I only take 5 strain one versus 11 strain, or maybe even get up to 14 different strains, how do you know if you're on the right track?
And I'll make sure I have a really good link to show you the probiotic per body part. And that's something I learned from a professor. Okay. One of my favorite professors at school. She was very, very strict about that, because you don't want to give someone a probiotic strain that is for vaginal health, for immune system, for your immune system.
Because interesting.
They all correlate with different parts of our body, and a lot of people don't know that either, because you're just like, oh, I'll just get this one, So I'll make sure I include it, because I don't know.
Okay, that's great.
But it is important to know this strain is for this part of the body, and this strain is for this part of the body. Got it.
Well, since 80% of immunity is in the gut, and you want to do one that's just really good for kind of overall boosting of immunity, does it matter?
It does matter, because it does matter. I only say it matters because you want to make sure that you have the right bacteria that's going to boost your gut to kick your immune system into play, especially in a season like this.
Got it. Okay.
I don't want to quote myself wrong, but I want to say it's acidophilus. It's one of the strains that you can take right now to help with your immune system. Could be wrong.
Okay. We'll clarify in the comments. Okay. So we'll let you do your research after. We'll clarify in the comments and make sure that we put a link to a really good one that Dr. Raquel recommends. Okay. And that way people will be on the right track. This is also, sometimes I get overwhelmed with the whole probiotic conversation. I can't possibly be the only one out there who does. I tend to sort of take it, and quite frankly, if I have good evidence of healthy, regular bowel movements, I'm sort of like, that's a good sign. And I don't know how scientific that is, Dr. Raquel, but I feel like if there's not much of evidence of a problem, as a layperson, I don't know what else to do, right, to know. So my question really is, how fragile is the ecosystem in the gut? If you have one bad food, or go on a fried food binge or pizza, and it throws off your microbiome for, a few days, will it restore itself? Or do you really need to go down the path of like making sure that you've got the right, probiotic to fix things?
Right. And that's such a good point, because one thing that we believe wholeheartedly in naturopathic medicine is our innate ability to heal. So that's the really cool thing about our bodies, is that it can heal itself. Your body can heal itself. So like you said, if you eat something that you should not have, when you remove that, your body will go into play to try to repair itself. Right. And sometimes it might need a little bit of help. Sometimes you might need to consume a little bit more fiber, or have a little bit more water, and just clear those things out without having to go on a full-on detox or start this whole probiotic regimen. Most of the time, when you remove the barrier, your body will heal.
Got it. Okay. That's really also great to know. Now, in the case of the probiotic conversation, I'm assuming that there's all kinds of factors that are kind of attacking the immunity cells from the gut, and it might be toxins in the food we eat, microplastics, some of the environmental toxins we breathe. What is that impact? Is that part of why our gut is so off? I mean, it just seems like it's a kind of a global epidemic of gut issues, being off, and autoimmune, rise of autoimmune diseases, and concerns about new viruses.
Absolutely. And that brings back around that whole interplay between the gut and the immune system, is because we do have those Peyer's patches in place to protect us. But what happens oftentimes is that there is a case of leaky gut, which all streams back to inflammation, like we talked about last week. Whenever our body is chronically inflamed, that immune system is overactivated, you know? And so it never has that chance to kind of bring itself back into balance. You know, the gut needs they need each other. It's a mutual, it's mutualistic. So the gut needs the immune system to say, okay, I'm ready to jump in, tell me what I need to do. And the immune system needs the gut too. So if the immune system is overactive, then the gut's kind of like, what should I do? Like, okay, I guess I'll just let this foreign bacteria in. The immune system's not coming to help me. So, okay, come foreign bacteria, you know, anything, just come in, because I don't have my star player to help me. And so that's why I feel like a lot of things kind of arise because we aren't doing the right things beforehand. Like we said, adding the probiotics, having the omega-3s, having the fiber. We're not doing the things right now, so that if we do come into contact with a brand new virus, right? Because a lot of us are getting better. If we come in contact with a new virus, we're like, you know what? I've been doing what I'm supposed to do. You know, I've been eating well. I've been taking vitamin C. I've been doing all these things. So even if my body, you know, comes in contact with it, it knows what to do to heal itself.
Got it. All right. You mentioned vitamin C. So we have acidophilus to boost immunity. We've got vitamin C to boost immunity. How does vitamin C play a role in all of this? If you know you're about to travel, or you know you have to travel for IVF, how is vitamin C going to impact things?
So vitamin C is an antioxidant, which there are so many amazing antioxidants, but it's one of those antioxidants that are integral in our immune system. So just like those Peyer's patches, it's something that kind of kicks our body into play or heightens our awareness to immunity. So what'll happen is, let's say you're not taking any vitamin C, and then all of a sudden you start taking it. It recruits the cells in your body to get your immune system to become more active, just like echinacea. It's another like tea that a lot of people take when they're sick. That it recruits those immune cells that your body needs to kick into action. So antioxidants are very, very important around this time. And don't forget that the acidophilus, it might be wrong. I'm gonna make sure.
Probiotics in general, we will make sure. But
I don't think that's right.
All right, we'll make sure though that we put the right information in the comments. Don't worry. I don't expect you to be a walking encyclopedia. I do want to understand something though, because probiotics are so important for gut health, and because your gut is 80% responsible for our immune system. Why? I mean, you're an MD. Why do we not prescribe probiotics as the first thing that we do, rather than antibiotics, which wipes out all of the good bacteria at one time? Or why don't we at least do intravenous antibiotics for people?
What's
the MD view on that world of this sort of mess we're in, of overprescribing antibiotics and everybody being on them and nobody having gut health?
And you know what's so interesting? I read a quote earlier today. I hope this doesn't mess me up, but I read a quote earlier today that said the reason why so many people are being exposed to these new viruses and microbes is because of the overuse of antibiotics. And I totally believe that, because I feel like what happens a lot of times is, like you said, it completely wipes out our gut from good bacteria and bad bacteria. And like we just learned, most of our cells are in our gut. So of course we're going to be, over infected and exposed to these new things because we don't have that protection. And so I totally agree that more doctors should, prescribe probiotics, but just like everything else, people are kind of late to the train of this whole, health thing. And so they just hear bacteria. So they're like, well, I would rather you not have any bacteria, without recognizing how much bacteria already exists.
Well, I think the thing that we're stumbling upon though is that everybody wants to do the thing to help them feel protected, truly be protected, and also kind of fight. And there's not everybody is with a company that's putting a travel ban on employment travel, and there are couples right now whose only option to pursue the path of parenthood is medical tourism.
Yep.
And they've already waited so long and they're already desperate and they've already invested so much time. The one thing that nobody, of course, expected was coronavirus to derail family planning. We've already stumbled upon 100 other things that get in the way of our path to parenthood. Coronavirus was nowhere on the list, until a month ago. So, because these things exist, and I think beyond just the hand washing, what you were saying is there are, absolutely actionable things that we can do right away to boost our own immune system. And I do believe it's really important to give people a feeling of agency over their own body. It's something that we advocate for all the time. And what greater thing to give you that sense of agency than doing the 3 things that could make a difference today.
Mm-hmm.
And it's the probiotics, it's the vitamin C, and I would advocate for a little exercise, just sweat it out even for 10 minutes, just sweat, right?
Absolutely. Definitely exercise. And remember, so many people think vitamin C, they're like, oh, I'll just drink orange juice or have an orange. There is just as much vitamin C in broccoli that there is in an orange. So have your green leafy vegetables. Not only will you be getting your vitamin C, but you'll also be getting your fiber to push any toxins you've been exposed to. It'll push it right out. So that's important too.
One final question before we wrap it up for everyone, which is the gut health for fertility in particular, because so much of this is really also kind of building your immune system so that you have the best possible environment to conceive and for it to be successful. So you mentioned that there's strains specifically for vaginal health, and I'm sure there's strains for kind of all over. When you work with people, are you just really looking to get them balanced with their gut health, or is there something in particular that people who are trying to conceive, like, you have to add this probiotic to your regimen?
So one of my favorite probiotics, hands down, and it's kind of like the one you got for you and your son, it contains 11 different strains. And I like that because it doesn't just target one system, it targets your whole body. And I really like that. It's Therabiotic Complete by Clear Labs. Amazing. I recommend it for just about all of my patients. What I try to do is get a profile to look at your specific gut. I can see what yeast you've been exposed to, literally the strand. I look at the yeast, the fungi, the bacteria. I see those things. And then the test also tells me how much of a probiotic you need. So based on that, I know how to dose the probiotic that I give you. But my favorite is definitely Therabiotic, for sure.
All right. Now, I thought that was going to be my last question, but it's not. Because as you're going through this and I'm thinking about, okay, one of the best aspects of, I think, your practice and a lot of the physician practices in the Fertility Answers platform is the willingness to do telemedicine consults. Absolutely. So you have a world of people that many are quarantined, many are in lockdown in different countries and cities and so forth. So if people need to reach out, they can actually get you by phone, do a phone consult. And then if they're in a position to go to a local lab, we're not talking about stool samples, we're talking about blood draws, correct?
Blood draws and urine sample.
And urine sample. So big relief, because most people don't want to give a fecal sample. So whenever you talk about the gut, I feel like people are like, don't go there. Don't go there. I don't want to talk about fecal samples. I already have to do that with the pets in my house. So I think this is really manageable though, because people can, hopefully get to a local lab and then they can work with you remotely to really clean things up.
Absolutely.
So
and
that's
it's
important.
It's a personalized plan for you. I try to make sure that not only am I meeting you and I'm seeing what's going on with you, but I'm able to give you a plan that's not completely structured and something I give to everybody. It's literally based on what your body tells me to do. So
that's wonderful. I love that so much. And how are people, we know we're going to put all your contacts below, but what's the best way for them to schedule a phone consult with you?
So the best way, I can make sure I add it as well, but you can contact us via Instagram at CRHG Fertility. And I'm also at Instagram at the Fertility Advantage. If you want to contact me by phone, our office number is 310-360-7584.
Okay. And this pertains to everybody around the world. So as long as Dr. Raquel has your data, she can definitely work with you. My son and I are both going to go through the program. We'll get a film crew to make sure that that we're followed so people can kind of see our personal experience with you, Dr. Raquel. I'm so grateful though. And I love these tips. So on Fertility Tip Tuesday, it's a probiotic. It's broccoli. Okay. Broccoli, not orange juice. It's broccoli. And
Broccoli.
it's a little bit of sweat every day. You don't have to go to the gym. I mean, just get moving and make yourself sweat for 10 minutes a day. I mean, I can think of all kinds of things that you can do trying to conceive that might cause a little sweating for 10 minutes. Okay. So this is Fertility Tip Tuesday with Alice Crisci and Dr. Raquel. We love spending time with you. Please comment below if you need us. And as always, you can find us on the Fertility Answers app, along with all of our other colleagues. It's about 300 of us now. Thank you so much, and we'll see you next week.
Bye.